Hello, lovely people of the world. Sarah here, the other half of Justin and Sarah from our YouTube channel, Love Withstanding. I look really tired. I don't know why I look tired. Today, baby is 11. Oh, honey, I need you. Come help me. I don't have enough fingers. It's my hubby, Justin. 11. Here's my hubby, Justin. I shouldn't say that. There you go. Today's Thursday, June 28th, which is the very last day of my week 11. Okay, so how far along am I? I'm 11 weeks and 6 days today. Or baby park, I guess, is 11 weeks and 6 days today. Symptoms. What are my symptoms? So, for this week, it's pretty much the same symptoms as last week. Oh, that was easy. I'm still feeling sore around here. Still and fuller. Justin is making faces. So yeah, still nasal, not congestion, more like runny nose. Just post-nasal drip, I guess. Just continuous dripping. I would say by now, actually, my nausea kind of is sort of disappearing. Sort of. Yeah, I mean, it's hard to tell. It's like at night, it's starting to be a lot easier, but still hard to swallow vitamins. That has not gone away. So next question, how much did I gain this week? I actually weighed 1.4 pounds more than last week. So you know how last week on week 10, I lost 1.4 pounds? I gained it this week. So yay, I'm so happy. I know it's weird. It's just I haven't gained any weight, it seems. Because whatever weight I gain, I seem to lose the next week. Whatever weight I lose, I gain again the week after. So it seems like I'm maintaining pretty much the same weight at 112.8 this week. So not sure what's going on there. Skin issues. I've been feeling itchiness not just on the back of my hands anymore. So that's good. But like, TMIL. I'm gonna point at my boobies. So basically, itchiness like around this area, like this side, the top, a little bit in between the chest. I try not to scratch because I'm afraid I might develop like acne or who knows, maybe even stretch marks along the way. So it's like, oh, try not to scratch. So what I do is like I poke. I poke. Anytime I'm itchy, I kind of poke. I don't know if you guys notice. I do that sometimes. But anyhow, so I'm just poking. Not in public, of course. I make sure I'm in a private place and I go like poke. And then poke. Oh, breakouts. Oh my god. It's bad. So it's still pretty bad. I don't know when it's gonna go away. It's like when this side of my face clears up, this side breaks out. When this side clears up, this side breaks out. I just don't know what to do with myself. I look like I'm wearing a mask and like I'm ready for Halloween. So yeah, I still need my foundation, y'all. I can't do without my foundation. It's just a simple foundation too. It's basic. Like, so you could tell, you could still see my spots, so it's really light on the skin. Next question. How am I sleeping? Soundly. I am sleeping so well. All I do is sleep. Next question. Highlight for this week. Okay. I had my first ever dental appointment since I had found out I was pregnant. So this was exciting. I was like, I'm on week 11. It should be pretty safe for me to announce, at least at the dental office, that I am preggo. So I'm like, okay. I got this. So went in for my dental appointment at 2 p.m. on a Wednesday. Sat on the chair and then they were like, okay, so it looks like you're due for your annual exam. So we're going to do a couple of x-rays and stuff. I'm like, hold up. Okay, guys, just so you know, I don't know if you feel it's necessary, but I am expecting our first ever baby. So she's like, oh my god, congratulations. And I'm like, oh, thank you. And then she went over to the next room. She's like, oh my god, she's pregnant. And then the next woman came out. She's like, oh my god, congratulations. I was trying to figure out, why is she telling everybody in the dental office? It's like, what? You didn't even get started. But okay, thank you for being so excited for me, you guys. Love you. So yeah, I was like, yeah, she's pregnant. I found out later on why she went next door. I'll tell you more about it in a bit. So yeah, she said, okay, so I guess we're not doing x-rays then. I mean, I'm not the one who told her that. She felt like maybe it's their protocol. Like when you're pregnant, they just won't do it. Won't risk it. Although I have read a lot of studies that said it's pretty safe. I mean, getting an x-ray is pretty safe nowadays compared to flying in a plane where there's way more radiation being emitted there. So not sure what the truth is, but that's what I heard. So yeah, so she went on with a dental procedure and she kept talking to me and asking me questions about my pregnancy and all that, and I'm like, how do I respond? She has my mouth wide open and she's working on me, and she would stop every once in a while so that I could like sort of drain all the drool and all that. Sorry guys, TMI, I just love gross stuff. So anyway, so she would give me the suction to kind of drain all that fluid inside my mouth, and then I would try to respond really quick, and then I had to let her do her job, because I mean, I didn't want to slow her down just because of all the excitement. I mean, I'm pretty sure she had other appointments after myself, so I was like, okay. And I was wearing scrubs, so she was like, are you showing yet? And I'm like, no, it's a little early, I'm only 11 weeks along. It's like, oh, that's amazing, good for you. So have you told your coworkers, your friends, your family? And I'm like, just really close family members, like immediate family. I haven't told everybody yet, but yeah, I'm really excited. So I told her that I normally get, you know how they say to wait for the first trimester to be over and done with, so around week 12-ish is when I should be okay to announce. And I'm so excited. I'm so excited. I'm gonna tell you why. I will be announcing to my coworkers right then and there tomorrow. I'm sorry, I can't wait till the end of week 12. I'm announcing tomorrow. So I'm gonna tell you, okay, so you know how I promised I'm gonna get back to why she went next door, the dental hygienist went next door to announce to another dental hygienist that I'm pregnant. So as soon as we were done with the procedure, like just general cleaning, flossing, no whitening I guess, polishing, scaling and all that jazz of my teeth, oh yeah, the dentist, the doctor, actually showed up to examine my teeth, and he congratulated me on the pregnancy, of course. And I'm like, oh, that's so sweet. Everybody's so sweet here and so considerate and thoughtful. And then he was like, the good news is we don't see any cavities, not one cavity in your teeth. And I'm like, oh, that is amazing. You have no idea, you guys. Almost every time I go see the dentist, which I do every 3 months nowadays because I get prone to cavities. Probably because I love my sugar, which I used to before pregnancy, really. And now I don't really seem to like sugar as much, or sugary sweet foods anymore. Bummer. But yeah, I guess it's good for babies, so I'm not gonna complain as much. It's not like I'm missing it either. It's just, I'm just out of it. But yeah. He was so proud of me. He was like, yeah, not a single cavity, not a single sign that you need to be careful what you eat and all that. He said that my teeth look really beautiful and strong, and that in his years of experience, it's been rare that he's seen a beautiful strong set of teeth, and he said I had them. So I'm like, I'm pretty sure it's a pregnancy that's caused this. I don't know. I mean, they did say that my gums were a little bit swollen. They're saying that which is very common in pregnancy, apparently. You get a little slightly swollen gums, and the hygienist said I produced a lot more bleeding when she was cleaning because my gums were sensitive. But they said that's normal. It's not like my teeth is going to fall off or anything, because I had to ask that question. I know, I'm weird like that. I was like, are my teeth gonna fall off? So yeah, they're like, no, your teeth are strong. I'm like, I know, that's my fear. My teeth are strong, my gums aren't, so is everything gonna, but no, they were like, that's normal in pregnancy, that's expected. I mean, that's our expectation anyway. Their only advice to me is to keep flossing. Because that, y'all, is what I haven't been able to do because let's just admit it, I'm lazy. I'm lazy! Oh, especially at the end of the night and I'm preggo. I'm like, I'm tired, I want to go to bed. So yeah, I promised them I would floss more for the sake of baby. So then the dentist went away and then I was dismissed for the day. But before I left, she called the dental hygienist next door again. She was like, hey, I heard you're pregnant, congratulations. And I'm like, oh, thank you. And then the hygienist who worked on me was like, do you know that she's pregnant too? I'm like, she's pregnant too? No way. I'm like, oh, it's hard to tell because she kind of looked pretty big boned on her arm, so it's hard to tell that she was even showing. And I'm like, how far along are you? And she was already like 5 months along or something like that. 5 months along. And I'm like, that's amazing. And she's like, oh, and with twins. I'm like, oh, your first set of babies, first time pregnancy, and she's pregnant with twins. And they said that her sonographer, like ultrasound specialist, actually told her that there seems to be a wave of first-time moms having multiples, so twins, triplets, quadruplets, you name it. And I was like, whoa. So yeah, so they're like, you're lucky you're not one of us who are having multiples. I'm like, am I lucky? Is that a bad thing to have multiples? I mean, I don't know. I mean, if I were to choose, of course I prefer to have healthy baby. But I mean, I guess for the first time, I don't really want to have twins. I mean, I'm clueless. I don't know how to take care of one baby, let alone 2 or 3. I was like, ugh. But yeah, kudos to those moms, first-time moms who are about to have twins, triplets, quadruplets and quintuplets. Like, holy mackerel, congratulations to you guys. It must be a blessing. I'm sure it's like a huge party every time, but yeah. Don't know, I'm pretty happy with 1, so we'll see. I mean, we can always make more later on. I stepped out of my dental office. I was so happy. Everybody was so sweet. Even at the reception area, they found out and they're like, oh, congratulations. I'm like, thank you. And they gave me a tray for whitening my teeth. So what they do is they send you home with a whitening solution in a syringe, and then they give you a tray that is custom made to your teeth. So yeah, the way it all fits in there. And they said they put it in a special purple container just for me because I seem like the purple kind of girl. And I'm like, they got it so right. They're so right. I mean, our wedding colors, y'all, was purple and silver. So I just love them for that. So I was so happy. I was like, it felt so good telling one more company or set of people that I'm pregnant. Okay, food cravings. That's the next question. What are my food cravings this week? I felt like I dropped something. What the hell? How is there a piece of apple in my hair? I don't know. So anyway, so our curly hair just picks up everything. Just salty food, y'all. That's all I've been craving. Salty, spicy. Justin and I went out and bought pickles yesterday. A jar of pickles, and they're so good. They're so good. Anything making me feel queasy or sick? Vitamins. Prenatal vitamins. I know a lot of you are gonna go like, well, if you feel queasy or nauseous at the end of the day, why don't you just take it in the morning, like your vitamins, or in the afternoons? Well, because the common side effect is constipation, it was highly recommended to take my vitamins at night, which my sister also did. That way I would be constipated overnight, and then by the time I wake up, I'm okay. I could actually have a regular bowel movement, you know? So yeah, I'm gonna stick tonight. They say to take it at the same time every day as possible, so I'm gonna stick with the nights. Am I happy or moody most of the time? I think I'm happy. I mean, I'm about to announce to coworkers, you guys. Oh my god, I'm so excited. I'm so excited. Oh, I'm sure a lot of them are gonna cry. I mean, I invited a bunch of them to our wedding, and they were bawling their eyes out as I was walking down the aisle. I was like, oh my god, you guys, you're not helping. So yeah, we all cried. So yeah, we'll see how it goes. I'm really excited. I don't know, there will be a few coworkers who have been trying to get pregnant that I'm not looking forward to announcing in front of them. I was like, but at the same time, I can't hide it anymore. And I do feel for them, you know, like I really feel for those moms, not moms, but future moms out there, or even moms, I guess, who are struggling and are really trying so hard to make a baby and to get pregnant, to conceive. And I really feel for you guys. I know you will have your rainbow baby one day, in the right time, when, you know, like, just have faith. Just don't give up. And if you do ever give up, like, don't feel so bad. Basically, don't give up. It'll happen. You know, just keep seeing your doctors, your specialists, whatever you have to do. There are lots of options out there, so I wish the very best for you guys. Rainbow baby is like, you know how you see a rainbow at the end of a storm? So after a hard time, all the depression of trying to conceive and failing to do so, that's what a rainbow baby is. Just a rainbow after the storm. What am I looking forward to? Y'all already know. I'm looking forward to turning 12 weeks old. As if me. I'm looking forward to Baby Park turning 12 weeks old tomorrow. So not only will I be announcing to coworkers tomorrow, as I might announce again on Saturday, day after tomorrow as well, because I'll be working a day shift tomorrow and then an evening shift on Saturday, just to be able to announce to as many coworkers as possible so they don't feel left out. The other thing I'm looking forward to for next week, on week 12, is our second ultrasound. Oh, honey, go. Our second ultrasound. They call it the first trimester screening ultrasound, so I'm excited. They're basically going to make sure everything's okay, and I think that's the ultrasound where they'll determine any genetic abnormalities that the baby might be prone to. So that's a little scary too, isn't it? So yeah, that's pretty much it for my week 11 update. Justin will be posting a few bump date photos coming up right about now. So yeah, as you can tell, I don't look that much different from last week. In fact, I don't know if you see a bump. That's mostly fat, I guess. I don't know. It's hard to tell. You guys compare from the very first update that we had on for week 4 onwards. To me, it looks exactly the same. So yeah, I can't wait to start popping. It's popping. It's popping. It's popping. That's it for me, you guys. Thank you so much for watching us and for tuning in to our updates. I really hope that you're enjoying our videos. If you do, please don't forget to hit the like or thumbs up button. And don't forget, for those of you who haven't subscribed, to subscribe. Hit the red subscribe button down below so you can get notifications on updates and all that. Yeah, sorry for those of you for boring you with pregnancy updates. It's just the highlight of our year, I guess, for now. So you'll be seeing a lot of those until baby part comes out. Thank you guys for watching, especially our YouTube families out there. Love y'all. Really appreciate your comments and your feedback, so feel free to drop in as many comments as you want. As you know, since I haven't made it public to coworkers or friends yet about the whole pregnancy, these have all been pre-recorded. So yeah, once that's been announced, we'll try to keep it as live as possible, as real-time as possible. Love you. Thank you guys. Have a lovely day and see you next week. Bye.